maybe 12 years ago, Great East Japan earthquake, magnitude 9.0 earthquake had occurred. And this is a Fukushima nuclear plant. And this nuclear plant was involved, and the radiation leak had occurred. And then the big wave, subsequent big wave, this is so-called tsunami. Tsunami, they wiped out everything, every houses and every persons. So the more than 15,000 persons had died. And until now, 2050, more than 2,500 persons are still missing. But now become recovered in this east side of Japan. This is a map of Japan, and the enlarged in this side. This is the so famous the metropolitan Tokyo, and this is the Tokyo Skytree and the Tokyo Tower. And the west side, this is a Kyoto Prefecture. Kyoto Prefecture is very famous for the ancient shrine and the temples. And next to Kyoto, this is a Shiga Prefecture. Shiga Prefecture is in my job place. And in all Japan, the population was 112 million, and the number of births is less than 800,000, and the number of deaths is 1.58 million. This is the nationwide issues that the aging and the low birth rate is a very big problem in Japan. Double figures that this is the double figure of the number of births. And this is a Shiga Prefecture. Shiga Prefecture is located at the center of Japan. And the population is 1.4 million. And the number of births and the number of deaths is maybe 1 per 100 in all over Japan. And the area of Shiga Prefecture is also 1 per 100 of Japan. So Shiga Prefecture is so-called the microcosm of Japan. And the Shiga Prefecture is this is very famous for the largest lake in Japan. This is so-called the Lake Biwa, largest lake in Japan. The area of this lake is 1 per 6 of all the prefecture. Our university is located here. This is our university, the Shiga University of Medical Science, and located in the Shiga Prefecture, near the Lake Biwa. So I would like to introduce myself. I am a professor of the Department of Legal Medicine, Shiga University Medical Science. And the next prefecture is Kyoto. I also a visiting professor of Department of Forensic Medicine, Kyoto Prefecture University of Medicine. And the visiting professor of Marine City Medical College and Hospital in Bangladesh. And I'm a visiting professor of Tokyo City University, and this is a department of mechanical engineering. And the visiting associate professor of the graduate school of Nagoya University, Department of Engineering. And also, I'm a of the Ministry of Justice of Regional Correction Headquarters and the Victim Support Center, and the also board of International Traffic Medicine Association, and the Associate Director of Japan Society of Traffic Science. So next, I talked about this investigation systems in Japan. This is a death certificate in Japan. This sheet is used in all over Japan. This certificate can be written by medical doctors. And this is a place of this, cause of this, and these items are maybe similar to the all over the world. Place of this, cause of this, time of this, and the type of cause of this. And according to this form, the procedure to release the family register. This certificate is summarized in the Japan, and the statistics are formed. This is the trend in the crude mortality rate for leading cause of death in Japan. The leading cause of death is malignant neoplasms, cancer. This is a leading cause of death, and followed by the heart disease and the seniority. Recently, aging is a nationwide problem in Japan, so the number of seniority increase, and then followed by the cerebrovascular disease and the pneumonia. This is a trend in the cause of death in Japan. And also, very, very high rate of suicide rate is a very characteristic in Japan. And this is the world suicide rate by countries. The most largest rate in suicide is South Korea, and followed by Hungary and Japan. Japan, the third most high rate of the suicide. Recently, the number of suicide has been decreased in Japan, but recently the pandemic of COVID-19, the suicide rate recently increased. Not in this slide, but the last year, the number of suicide increased and over the 20,000. So the trend is again increase in Japan. This is a very, very nationwide problem. And this is the statistics of the deaths about Japan. This is a place of death, the distribution of place of death. The 2/3 of persons have died of medical facilities, hospitals, and followed by the nursing homes. Recently, the rate of nursing home has become increased because of the aging in Japan. And this is the distribution of the cause of death. Death by disease is the most popular, followed by the death by all, seniority, followed by seniority, and the accident, suicide, homicide. So disease death is most common in Japan. And this is the number of unusual deaths in Japan. We forensic pathologists deal with unusual deaths daily. The number of unusual deaths in Japan is almost constant, and 119,000 for these maybe 20 years. Not so changed, almost constant. And the color of is autopsy cases, and the color of blue is not autopsy cases. In Japan, among the unusual deaths, autopsy was performed for only 10%. This is low rate of autopsy in Japan. This is a procedure for handling the deaths in Japan. The victim under the medical care, if the victim died, the death was diagnosed by a medical doctor, a physician, diagnosed by a physician. And the physician decided whether usual death or the unusual death. If the physician decided this is unusual death, the physician called to the police. On the other hand, if the death was found without medical care, for example, the hanging or the falling, or the traffic accident, the police was called, and this is the same. The police was called, and then external investigation was performed by the police inspector and the medical doctor. And after that, if this is the decided as a criminal death, the judicial autopsy is performed. This is maybe similar to Panama. And after that, this is decided as a non-criminal death. the autopsy was performed only 10% of cases. Most of the cases, autopsy is not performed by the external findings, only by decided by the external findings. In Japan, the usual death is maybe 19%. Unusual death is maybe 10%. Among the unusual deaths, criminal death is about 10%. Non-criminal death is about 90%. So in Japan, the criminal death is very small. This rate is very small in Japan. And in Japan, medical examiner's office is only active in these three cities. This is Tokyo, Osaka, and Kobe. Victor Amengol is living in this Hyogo, Kobe. And only these three cities, the forensic specialist or forensic pathologist is in these facilities and perform the external examination or forensic autopsies. But most of these cities, most of the doctors were part-time doctors. The full-time doctor number is very small. For example, this is Osaka Prefecture Office of Medical Examiner. The full-time doctor is only one. The other doctors are all part-time doctors, forensic pathologists. Or the other areas, the external examination is performed by the general physician, not forensic specialist. And after that, forensic autopsies were performed by the forensic specialist or forensic pathologist. And the forensic autopsy was performed all university all over the world, a department of forensic medicine or department of legal medicine. And the forensic pathologist performed the autopsy. And in Japan, there are 4 types of autopsies. This first of this judicial autopsy, this is performed for the criminal death cases in Japan. And the administrative autopsy was performed for the non-criminal deaths in areas with a medical examiner's office. So in 3 cities, for the non-criminal deaths, administrative autopsy was performed. In other cities, most of the cities, consent autopsies with the family's consent autopsy, or based on the new law, autopsy was performed. Previously, this autopsy was not, there are no these laws in Japan. So the consent autopsy was performed. But consented case is very small. The autopsy rate is smaller than now. So a new law was established, act on cause of this investigations and identification of the bodies handled by the police. According to this law, the family's consent is not required. So the police decided this is necessary for autopsy. The autopsy can be performed without the family's consent. There are some concerns regarding this systems in Japan. The concern first is overlooking of unusual deaths. Some of medical doctors lose the report of unusual deaths for the police. In Japan, there is a guideline for notification of unusual deaths, deaths from external causes, deaths from complications of external causes, deaths from unknown causes. In these cases, the medical doctor have to call the police. But some of the doctors lose the call to the police. And for example, the Australia or the Sweden, there are coroner law or funeral law. So this is performed by, this decision is performed by the forensic specialist. But in Japan, most of the cases, this decision was performed by the general physician. But autopsy was performed by the specialist. And the second concern is low rate of forensic autopsies in Japan. Only 10% of reported unusual deaths receive forensic autopsies. As I said previously, the decision of performing autopsy is determined by the police inspector or the result of external findings. So the autopsy rate is very low in Japan. And according to the report of the abroad, in Australia, the autopsy rate is 50%. And in Sweden, the autopsy rate is maybe 90%, very high. So I think this 10% is very low in developed countries in Japan. And next, we talked about the numbers of forensic specialists in Japan. And the number of members of Japan Society of Legal Medicine in the 1,030 to 1,400. This is a member of Society of Japan Society of Legal Medicine. And this is the number of board certificated doctor of forensic medicine. This is 147, very small. And the number of board certified instructing doctor of the forensic medicine is only 35 all over Japan. I am one of 35. This is in Japan the number of board certified doctor of internal medicine. This is 88,000, maybe 88,000. And this is the board certified surgeons in Japan, 24,000. Comparing these figures, very, very small in the Japan Society of Legal Medicine. And at forensic autopsy, we get information from the police and the imaging test, CT, X-ray, and the external examination and the internal examination, and also perform the blood chemical test and the recently the infectious test, the COVID-19, HCV, influenza, and alcohol and toxicological examination, histophysiological examination, and if necessary, performed other tests. Maybe this is similar to all over the world, I think. Okay, so the next we talked about the job of our department. Our department is located in the Shiga Prefecture, so we performed all forensic autopsies in the Shiga Prefectures. This number is annually 160. And I am a chair of the Council for Promotion of a Correct Cause of Death in Shiga Prefecture. And the Japanese government promoted the correct cause of death and decided to set the council for promotion of correct cause of death in each prefecture. So I am the chief of the correct cause of death, promotion of correct cause of death council in Shiga Prefecture. And we perform the clinical forensic medicine. So consultation, assessment for the victims for abused children or abused elderlies. Recently, the number of elderlies increased in Japan. So accordingly, the number of the abused elderly has also become increased. And the psychological care for the victims, this is a victim suffered from the sexual abuse or the other assault. And the correction medicine is a medical systems in the prison. I am a physician at the juvenile training school. This is the less than 20 years old boys and the girls. And also the physician at the prison. This is an adult in the prison. And the witness appearance give this testimony in criminal and civil court. I previously said that forensic autopsy was performed and this examination was performed, and we decided the cause of death and time of death, and clarified the severity and extent of injuries, and reconstructing the mechanism of injuries. So I see the examples of the reconstructing the mechanism of injuries in the next slide. And this is a reconstruction of the frontal vehicle impact. and the driver has not fastened seatbelt. After impact, evac deployed, but not wearing seatbelt, the body moved to forward, and the neck was maybe instant death by the neck injuries. This is a frontal collision. And this is an example of the lateral collision. Please, this button, put. Okay, this maybe he suffered from a severe fatal injuries and the lateral collision with a velocity of 48 kilometers per hour, or the falling from the face. And the distribution of the distribution pressures shown by the computer simulation. And this is a reconstruction of these injuries. Next, we show the number of child abuse counseling response in child consultation center in Japan. In Japan, the number of child abuse has been increased. And 2021, the abused person, abused children, boys and girls, the number is more than 200,000. A very, very high number of children were abused. I examined the abused children. This is a 13 years old boy. Ligature marks were shown in the neck. He had been strangled by his mother, and the next day his mother was arrested. This is a boy of 2 months. We can see the thigh bone fracture. But we can decide the mechanism of injuries of the boy. And the shape of the fracture is spiral fractures. A spiral fracture is biomechanically occurred by the twist. And I decided that the boy was twisted his thigh. Also, this is performed by the parent. And the mother and the father were arrested the next day. And this is the round ulcers in the arms, and the very old one and the new one. This is a typical findings of the tobacco cigarette injury. Tobacco cigarette was put to the arms and the burn injuries. And this is, we can see the discoloration of the faces. This is blood by his father. And there are many abused children in Japan. And this is the victims and suffered from the assault and sexual violences. And this girl, 20 years girl, suffered from the many abrasion and contusion and upper limbs and the lower limbs. And it is difficult to see by these figures, but the face was congested, and his neck, her neck is showing the ligature marks, and the reappearance of the issues that this girl had suffered from the multiple injury blowing by the man, and then strangled by his neck. And he lost her consciousness, and then suffered from sexual abuse. So after I see this girl, I connected to the psychiatric doctors to provide mental care, and cooperated with the victim support centers. In Japan, in every prefecture, there are victim support center. This center was so-called Early Assistance Providing Group for Crime Victims. And this is designated by each prefecture's Public Safety Commission. So our Victim Support Center, for example, in Shiga is called All Victim Support Center, is located in each prefecture. And then also the sexual assault victim total care one-stop vehicle. This is so-called Satoko is in Shiga Prefecture. These one-stop center for victims of sexual crimes and sexual violences is also located in prefecture. This is based on the basic plan for crime victims. This is decided by the government in Japan. So in all prefecture, victim support center and one-stop center for the sexual crimes located in Japan. And I am also a physician of the juvenile training center in the prison for the girls and boys. And I examined the experiment of abuse. You had received abuse you had received abuse or not? I asked to all the members of the inmates of juvenile training. So, or the in boys, maybe 1/3, and in girls, maybe 2/3 were suffered from the abuse in baby boys and girlhood. So they suffered from abuse. So because they suffered from abuse, they become disturbance of development and impair the cognitive development and impair the emotional control and attachment disorders. These are the characteristics of abused children. So abused children tend to attack others and tend to injure others. This is a so-called chain of abuse. So usually I found the abused children and taking into protective custody. This is he saves the children's life. This is a secondary prevention. But it is important to the primary prevention, preventing the occurrence of child abuse because we stop the chain of abuse. So I think these decrease the chain of abuse is important in Japan, I think. Okay, the next is the research of our department. And the research of our department is for first the prevention of injuries, the impact of biomechanics and the injury epidemiology and the reconstruction for traffic accidents and safety for pregnant women. And the safety for pregnant women and the reconstruction of a traffic accident is I will talk about the tomorrow morning. And the clinical toxicology, forensic pathology, like forensic entomology, using the fly larvae attached in the body, and the biorheology and the clinical laboratory. And this is the one case of establishment of preventive measure with biomechanical perspectives. This is the fatal traffic accident cases. A 6-year-old boy was collided by this vehicle, and the vehicle in front of the vehicle was distracted, and the left side of head and face were attacked to the this front body of the vehicle. This is a reconstruction of the collision cases. Okay, and they suffered from the skull fracture and the mandibular fracture. And this is a distribution of the pressures of the reconstructed by the computer simulation and the analysis of the mechanism injuries. So I propose that for prevent these fatal accident, external airbags deployed for the pedestrian is very important, I propose. This is the establishment of preventive measures with biomechanical perspectives. And in Japan, I previously talked about that the low birth rate is a nationwide problem. And this is the rate of the juvenile, productive, and aging populations in the world, especially for the developed countries. The rate is smallest in juvenile population in Japan. On the other hand, aging population rate is very highest in all over the world. So we have to save the children because the number of children is very small in Japan. So recently, Japan promoted the child distribute. A child distribute is a system in which multidisciplinary agents work together to investigate, register, and review the deaths of all children and suggest effective preventive strategies and intervention. And the child distribute is promoting because of these laws, a basic act for child and maternal health and child development, and the basic act for promoting the determination of cause of death. So the model project of CDL was started in the part of Japan in the 3 years ago. This model project was performed in our prefecture, Shiga prefecture. And, this is a case of the suffocation of the baby. The baby, 2 months baby, was co-stripped with parents and brothers in this very narrow areas. In Japan, traditionally co-stripping is performed in the many homes. And the baby and the brother and the both parents are together stripped in these narrow areas. This is because of the importance of bonding between the parents and the baby. But the brother blanket but covered on the face of the baby, and the baby has suffered from suffocation. It is very risky in Japan. And it has substantially contributed to the unexpected infant death in Japan. And also recently, this is a distribution of the external cause of this in 2020. Asphyxia and the traffic accident is the most common in this year. But recently, the number of suicide become increased also for the children. In 2021 and in the last year also, the suicide is the most common cause of this. This is many challenges still remain in Japan. Maybe due to the COVID-19. I think so too. Maybe due to COVID-19, in adults, the suicide number increased in Japan, and also the number of suicide children are also increased. So this is the next our challenges to decrease the suicide. Okay, finally, we talked about education of our department. Our department performed education for the medical and the postgraduate medical student, so the educating forensic medicine. And the postgraduate mechanical engineering student performed education for injury biomechanics. And for nursing student, forensic nursing performed for nursing student. And for midwifery student, we educated the safety for pregnant women because the number of births is very small. So we have to save the pregnant women to save the fetuses. And for the policemen, special course for post-mortem investigation for performing for the policemen. And for legal training, forensic medicine and criminology. And for the physicians at the Distinct Medical Association, we perform the education for the postmortem diagnosis or how to perform the postmortem investigation. And for caregivers, end-of-life care at home. So we perform the very variety of education in a department. And we have once, one time or 2 times 1 year, we perform the training for the large disaster with many fatalities. So in my first slide, I show the catastrophic disaster in Japan. And in Japan, the typhoon, earthquakes, and sometimes many disasters occurred with many fatalities. So we perform the training for the large disaster. This is the large-scale traffic accident death, and this is a rescue, the training for the rescue. And this is a training for the DMAT. DMAT is a disaster medical assistant team. Disaster medical assistant team rescues injured person, rescues injured person. And the next, DMAT perform the triage. Next slide. They perform the triage, and this is the triage tag, and put the triage tag, black meaning dead, and the immediate transport meaning red, and the next transport meaning yellow, and the not so hurry transport is meaning green. And the team of DMAT members put each bodies to this black or red or yellow or green. If the black is put, this is the cadaver, so we policemen and we forensic pathologists see this body. And this is a emergency crew because this one was put the black one. So the emergency crew transported to the policeman. The policeman receives this body. And the physician, this is a physician examine the body. This is a training of the external findings. The physician examine the body and decided the time of death and decided the cause of death. Oh. Okay. And the large disasters, we have to personal identification is very important. The policeman examine the fingerprint. This policeman examine the fingerprint, and the dentist examine the dental characteristics of and this is a dental chart of the dead bodies. And according to this dental chart, the personal identification is performed. And this is a grief care for the victims' families. The disaster maturity operation response team. This is so-called the DMOT. The member of DMOT he perform the grief care for the families and the dead person, the families. These training is performed 1 time or 2 times in Japan, especially in the Shiga prefecture. And thank you for the kind attendance. And I hope that the good collaboration between Japan and Panama and between Japanese conference, Japanese society and society. I hope the good collaboration for the future. Thank you for your attendance. Thank you very much.
Excelente ponencia del doctor Masahito Hitosugi. Tenemos una pregunta para el doctor que dice lo siguiente. ¿Qué medidas han tomado para enfrentar el incremento de suicidios de menores en Japón?
Thank you very much. Thank you. Very good question. And in adult, most of the cause of suicide is health problems, suffering from psychiatric disease in adults. But in the children, this is very difficult to determine the correct cause of suicide. But in the most popular cause is relationship, personal relationship with a friend, and personal relationship with a parent. This is the most popular causes. And the next, maybe next is the disease or health problem, the psychiatric problem. And recently, the psychiatric problem in the children is become popular in Japan. But now the most popular cause is a relationship, marriage relationship. Okay.
Siguiente pregunta. ¿Cuáles son los factores influyentes, ya que las estadísticas muestran que es más alta la morbilidad que la natalidad? ¿Sí? ¿Cuáles son los factores influyentes? Ya que las estadísticas muestran que es más alta la morbilidad que la natalidad.
Yes, thank you very much. Thank you. Nice question. That maybe the aging. Japan has a dramatically increased the aging, so the number of deaths is very increased recently. Recent 10 years dramatically increased the number of deaths, and most of the number of deaths is the seniority. The cause of death, seniority is dramatically increased. I think this is a major reason.
Muchísimas gracias, doctor. Le solicitamos a nuestro director general del Instituto de Medicina Legal entregar la certificación por participación. Un fuerte aplauso para nuestro
Thank you very much. Thank you very
expositor.
much. Ah.